May has come and gone, of course, but here's something about the month that you probably didn't realize. May was Better Hearing and Speech Month. Did you know that? Well, Jennifer Cox and Ellen Simmons are certainly aware of it. They're with Ranken Jordan Pediatric Bridge Hospital to talk about the services that they offer over there. And speech therapy, we hear that. We hear about the degrees in it when our kids are going to college. What is it exactly?
So in general, speech therapy evaluates and treats people with communication and feeding disorders, whether it's acquired through an illness or injury or from birth.
Mm-hmm. And is it easy to diagnose these? Do they usually get a referral from your pediatrician that says we may have a speech issue here early on?
Exactly. So we get a referral from the pediatrician, and that may come from a parent concern or a school concern. Mm-hmm. And then a doctor will write a script for a speech therapy evaluation. Do
some of these things come a little later in life too? Do they manifest themselves later on? You don't see them coming?
Absolutely. Sometimes they're from birth, and sometimes it's acquired through an illness or injury. But yes, sometimes it can happen at any age.
So talk to us about some of the treatments that you do at Ranken Jordan.
Sure. So at Ranken Jordan, we are a pediatric hospital, so we're focused on the children and young adults. But I would say on the inpatient side, we primarily see those acquired illnesses or injuries, whether it be cancer and repercussions from those treatments, or a traumatic brain injury that results in some kind of lack of communication or feeding disorder. We also see a lot of premature, either infants and toddlers who have been prolonged hospitalizations in the neonatal intensive care unit at other hospitals, and then come to us with complex care needs, including speech therapy.
So there can be actual physical issues that you can do workarounds, I guess is the layman's way of saying it. I wanted to ask you, because it's a bridge hospital, you're dealing with kids, like you said, that have been in other kinds of medical situations that kind of bridge back to going home through Ranken Jordan, right?
Yep, exactly.
And what kinds of services do they look forward to?
So we also have outpatient therapy. Mm-hmm. So we work both inpatient to try and get a child home, and then from that point we also work with them on an outpatient basis. So some of the things that we provide are, we talked about articulation disorders, and that's how a child is producing sounds, but we also look at expressive communication, how they're communicating basic wants and needs, receptive communication, which is how they're processing language. We look at feeding disorders, and then we also look at cognition, which is, that includes like memory, attention, problem-solving skills. We work with other professionals as well, and we also work with parents and helping them come up with the coping strategies they need to take home.
And I can tell you right now, you have to remember this is a pediatric bridge hospital, and you have to make it fun for kids, and they go out of their way to make sure that happens. To learn more about Ranken Jordan's speech therapy services, visit rankenjordan.org, or if you have any questions about the speech therapy program, call 314-872-6400 and ask to speak to a care coordinator in the speech therapy department, a care coordinator in the speech therapy department. They'll take good care of you.